And we are now live on Facebook. So welcome everybody, and welcome dear guest speakers. Thank you so much for taking a part of your busy time to dedicate a few minutes today to the Health Data Forum Global Hybrid Summit. It's really a pleasure to have you here, and it's really great that you have accepted the challenge of participating in this roundtable on health data and COVID-19. It's so relevant for the times we are living right now. And just a reminder that the location you're seeing behind me is the venue, the actual venue where we hoped we could all be here today face to face and in presence. Unfortunately, this was not possible. So let's keep the spirit. Let's try to learn from each other. And without further ado, I would ask each of our guest speakers to do a round of self-presentations as we have agreed. Perhaps we could do alphabetical order in order to make everything easier, right? So starting probably Patrícia and...
Thank you. Usually I'm not the first one alphabetically.
That's ladies first, right? Ladies first, right?
Always, even in COVID times. So thank you again for inviting me to join you here today. I would like to say hello to all our speakers and to everybody that is listening to us. My name is Patrícia Calado. For the past 5 years, I have been representing Portugal in the European Research and Innovation Funding Program, Horizon 2020, that now it's closing and starting the new program, Horizon Europe. So my view here, as I said previously to Paulo, I'm not a health data expert, but I have the view of the strategic goals in terms of health research and innovation in Europe. And I followed very closely European response to the COVID pandemic, including what concerns to health data. That is what Pedro Beltrao will specifically focus today, and so I will try to give you my perspective on that. Thank you.
Fantastic. And I apologize because ladies first, definitely not alphabetical order. Alphabetical order will be Kaveh. So now let's do alphabetical order for the man in this panel.
Sure. Hi. Good afternoon. Caf Safari. I lead Accenture's global healthcare practice, which is the part of our business that works at the intersection of business and technology for insurers and providers and governments. And I've been doing this kind of work my whole career. I've worked in a couple of dozen countries, and I'm also a physician by original training. And I'm talking to you from Chicago, so it's about 7 o'clock in the morning here, and I'm happy to be with you.
Okay, thank you so much for being an early bird.
That's no problem.
So I guess it's me. So my name is Pedro Beltrao. I'm a research group leader at the European Bioinformatics Institute, which is part of the European Molecular Biology Laboratory. I'm very much a research science focused on molecular biology, but using computational methods to try to understand how genetic changes lead to disease or at least trait variations. And as I'm going to tell you a bit about the work of my research institute, but also the research of my group and sort of linking molecular data with patient records in COVID.
Right. Last but not least.
Yeah, is this me, Rajendra?
It's you. Yes, you.
Hey, thank you. So good morning, good afternoon, good evening. You know, I know we are representing different time zones. I am Rajendra, I'm from Mumbai and have been in digital health for more than 2 decades. I currently chair the Dynamic Coalition on Internet and Jobs at the Internet Governance Forum, United Nations. I also chaired the drafting committee for standards for digital health in India. And I've served as an advisor to the Health Minister of India in the past, and digital health remains to be my passion. I'm going to talk about how data is being used in health and related to how we are doing it in COVID. Thank you.
So thank you so much for the round of introductions. This was useful for setting the context of this panel of guest speakers and where they are contributing from and their geographical locations. So thank you so much for making this a global summit. So you have India, Chicago, London, and Lisbon. Thank you so much. And definitely, so let's now do a start of the session by doing a series of presentations to set a little bit the context and the perspectives. So Pedro Beltrao is going to do an opening presentation, then followed by Professor Rajendra Gupta, and then finally Patrícia Calado from AICIB, which has also a nice presentation I would like to share. And after this round of presentations being shared, then we'll start the panel with the debate.
Okay, so I'll jump in. So as I said, I'm just going to show you very briefly two things that are worth, I think, sharing. One is my institute is developing this European COVID-19 data platform, and also a little bit about the research that my research group has been doing in terms of linking molecular data with patient information. And so very, very briefly, what this COVID-19 data platform is an attempt to collect diverse sources of data that relates to COVID-19. I'll tell you what the scope is, share this data as rapidly as possible, and allow for different degrees of aggregation, validation, or completeness. So it tries to be versatile in a way that copes with different types of information. So the scope is shown on this sort of complicated graph, but just to say what this is and what this is not. So it's meant to collect molecular information coming from lab experiments, and also genetic data from patients. So this would be patients that have COVID and have been already studied for their DNA profile. What this does not have, it's not scope of this portal to carry information, for example, of health records or epidemiologic information, such as where the people and how the disease is spreading or the virus is spreading. So it's really about molecular changes and the DNA information of patients. This is it has a forward-facing portal, which is described here, and this is primarily these days more focused for researchers that are interested in understanding the molecular changes that happen in a cell once it's infected by the virus. So I'm going to show you just a little bit of research that we've done over the past 7 months, and the focus of this research is an international study. Sorry about the background, but so the focus here is in trying to understand what are the molecular changes happening in the human cell once it's infected by the virus. Because if you can understand that, we can suggest drugs that could revert that effect. And so this is a research that's been carried out by over 200 scientists, 15 institutions, and we've published now 3 papers over the course of the last 9 months. And again, I'm representing this, but we have to see that this is really an effort by many, many different people. So again, the objective here is the virus will infect the cells, and we can do a series of biological experiments, which I'm not going to go into detail, to try to understand which are the human genes or the proteins that are changed by the virus, needed by the virus for its replication. My group's effort here is on the computational analysis of these data sets, with a primary goal of understanding how the virus works to identify drugs that could stop it. So this is just one example of one of our molecular findings, which was that this virus induces this formation of these finger-like structures. So a typical cell would not often have these types of structures, but once it's infected by SARS-CoV-2, it induces these formations, these filopodia. And what we think is this could be relevant to infect nearby cells or to help the virus escape once it's being produced and replicating. So the other major outcome of these studies was that we tested over 100 different compounds that were predicted from our experiments that we could targeted specific human proteins to stopping the replication. This is one work done by the Institut Pasteur and also the Icahn School of Medicine in Mount Sinai. And of these 100 compounds that we tested, about 20 had strong antiviral effects in a cell-based model, which is very critical to stress that this is not patient data. At this moment, this is really just saying that in a cell-based assay, these 20 odd compounds had good antiviral responses. So for example, in these cell-based assays, as been shown by other people as well, remdesivir has a very potent response, but not necessarily this is going to translate into the clinic. So then I'm just going to show you 2 examples that we worked on together with, again, in the context of this large collaboration, where we could link this type of information with then health records or patient data. So one way that we can do that is we can take human genes that we think are critical for the infection from these lab studies, and then we can combine this with genetic information. And the way this is done is schematized here with one example. This is a real example that we found through our studies. But because there's now over at least 8,000 hospitalized COVID patients for which there's genetic data, we can find genetic variation in these patients that seems to predispose them to a lower or higher risk of COVID-19, either hospitalization or just carrying the disease. And then through ways which I cannot really explain now in detail, we can identify genes that are linked to that genetic variation. In this case, EL17 receptor was one of these genes. And because we have this molecular data that from the experimental labs setting, we can combine these two pieces of evidence to suggest that EL17 receptor is an interesting gene that modulates both the SARS-CoV-2 replication in the lab, but also the risk of having a COVID-19. And finally, another way that we can do this type of combination of information is we've identified drugs that have antiviral effect in the lab. Could we go back to the health records and mine this for retrospective use? So we have now in this study in particular, a company that was involved in this study with us has information for about 700,000 infected human individuals with COVID-19 for which health record information is available. So we could go back and say, what if somebody was infected and saw some specific drug? Were these people less or more or less likely to have seriously hospitalized consequences? So in this particular example, we from both the cell line work, from the lab work, and from this type of patient records, we could identify namentassine as a potential drug that could modulate the risk of having serious complications from the disease. And of course, this is not a clinical trial, right? It's important still to state that this is really at this moment just suggesting strongly that namentassine could be a relevant candidate for clinical trial studies. So as a summary, I think it's also important to state this is really the most intense single-minded focus research that's ever done. And by this, I don't mean us, but I mean just science in general. This has never been done before in such a short amount of time. So much research is being done on this, and it's quite difficult to keep track of this information. And so being able to organize both the molecular and the patient data is critical to make progress, not just for this particular case, but I think going forward, I think this is going to be the future. Understanding how the molecular details, of course, better help us understand why some drugs would work, and combining molecular data with patient genetic and health records is likely to be a growing trend for the future in terms of health and treatments. And with that, I'll stop.
Okay, so thank you so much, Pedro, for bringing us such as groundbreaking information from the front. This is like a war we are fighting, and it's really interesting to see the efforts on that front of research. So next presentation could be Professor Rajendra Gupta. Do you want to share your slides, please?
Yes. So Paul, firstly, thank you and the Health Data Forum for giving us this opportunity. Though I personally love Portugal, I would have loved to be there. And my favorite bookstore, which is the world's oldest operating bookstore, Birthland, which I visit. I miss not being in Portugal, but hopefully next time I should be there. That's a great place. And I thank the Health Data Forum, the organizers and the sponsors for getting such an eminent panel for discussing one of the biggest challenges of our time. So I'm going to straight away jump into my slide. I just have one slide. So I'm going to talk about not just COVID, but how in the past we have been using data, big data, to save ourselves from similar challenges. So I have this first example of Kenya. You know, this is a very interesting example of how the mobile data was used with 15 million population. Their cell phone calls, their text were tracked for over years time and led to some very interesting findings. And this was done by researchers from Harvard. So when they looked at the data for over a year, they realized that though the vector lives and spreads to only 1 kilometer, but the people actually are much more mobile in Kenya. What was initially thought that this would be like the Lake Victoria and the coastal regions, which are the hotbeds. When they tracked the cell phone data through the towers, they realized that actually it was not the coastal areas. It was just the Lake Victoria region, and the people in Kenya and even people working in Nairobi, the capital, they would go back to their rural areas after work. So they became the super spreaders. So for countries, how data gets important, it is something for us to learn from the past. I'm talking of something that happened close to a decade ago. So just imagine that with this data being available, they were able to exactly focus their resources of what are the hotspots to manage malaria spread. So they could tell people that if you're passing by Lake Victoria, that is the place where you need to use bed nets or, avoid a mosquito bite. So this is where the reality of the scenario is that at any point in time, it is the data that will be important for us to manage. And this is not just with COVID, it has happened in the past. And I would love to have dwelled in more details with more examples, but I have a limitation that I have just completed a book on digital health, which is going to be launched worldwide by mid-December. So I have a copyright challenge with my publisher not to disclose more of the contents till the book is out. So I'm going to touch just briefly. So there is an interesting thing of how people are using data. When you look at certain searches that are happening on certain symptoms, which are matching the spread of a particular disease or an epidemic or a pandemic like this, utilizing data, you can actually figure out if that area is having a similar spread. And this has been tested, validated over years. So there is immense amount of data available, and there are newer dimensions like this can come straight away from social media. People who start searching about fever, the cold, and other symptoms associated with the pandemic, you can actually figure out and spot, okay, hey, look, let us research and find out this area at the ground level. Is there something similar happening? So there are various facets and dimensions to how we look at disease. There's another opportunity out here about when the pandemic or epidemics or such things spread. Social media and even others to spread information which necessarily may not be authentic. And we have seen accidentally how large organizations have all
Paulo, you're on mute.
I think we lost Professor Gupta for just one moment. Let's wait a little bit. If Zoom establishes, let's all be patient here for internet connections. Oh, unfortunately, it dropped. I think it will be back in a few minutes. And but maybe for the sake of the time, Patrícia, would you be so kind to share your slides now? And then probably when Professor Gupta gets back in, we'll finish his application. You are on mute, Patrícia, also.
As I say, the most frequent sentence during the pandemic is "you are on mute now." Share screen. Okay. So please let me know if you see my slides. Do you? Okay, thank you so much. So, especially for the Portuguese viewers, I am now working since March in the recent Portuguese agency, which is AICIB, the Agency for Clinical Research and Biomedical Innovation. We incorporated all the front that I'm involved in relating to the European framework program, apart from doing, of course, other relevant things. So we are kind of the new kid on the block in health research and innovation in Portugal. My perspective today, it's a bit to share with you, and I have a few slides that I want to show you, and then we are even available to share the slides with the audience if possible. You can contact me for further information. Health data is key for European health research and innovation and for European health systems. We have a long track record of regulation in this field, but one of the most important hallmarks was in April 2018, when the European Commission released a set of information which was called the data package. And this data package included a specific communication on digital transformation and health and care in the digital single market priorities. So a communication specifically focusing on the importance of digital health and care. And in this communication, this is like the really short summary. The European Commission identifies the health challenges that we face, and refers to digital applications and data as a major strategic goal to solve these challenges. And the Commission defines 3 priorities. The first one, it's citizens secure access to their health data, also cross borders. So this means that we should be able to access our health data when we travel across the EU. So if I go to Brussels, which I don't do anymore, now COVID has changed a bit our lives, but I should be able to go to a hospital, to a pharmacy, and have access to my data. The second priority is that we can use personalized medicine. We can practice personalized medicine, do research on personalized medicine by having data pooled for research. This means that we need to invest and to perform specific actions on this front and to develop initiatives on this front. And the third priority is the citizen empowerment with digital tools so that we can give feedback and we can really provide a person-centered care. What does the Commission want with these 3 priorities? This means that the Commission has to take actions and countries have to work in order to reach these priorities. And for each of them, many things are happening at European level. So this has been like the framing legislation since 2018, and we have been working on this since then. More recently, now in February 2020, the European Commission published an European data strategy, which goes a bit along the same lines and reinforces what the previous communication stated. So we are all aware in Europe that we need data-driven healthcare and innovation, and that all the tools that we have available so far can strongly contribute to better health of the citizens, right? In prevention and risk detection, therapies, diagnostics, and eventually in new health and care models. What do I have to show you today? What I have to show you is that the European Union sets this as priorities and then invests in projects that put together stakeholders from different countries so that we try to reach these goals. And this is what the European Research and Innovation Program does when it concerns to the health area. So here in the slide, you have a few examples, not related to COVID yet, but just a selection. These are recent projects, 6 of them are shown here. Actually, Portugal participates in 4 of them, of projects that are related to health and that all want to contribute to the improvement of health of citizens, or some are specifically focused on the aging population, others in neurological diseases, others like Smart for Health, which Portugal coordinates, are specifically working on the exchange of electronic health records. A lot of money is being invested. All these projects need that at least 3 European countries are working with the same goal. So this research and innovation that the European Commission is funding, it's multidisciplinary, it's cross-sectoral, and it's transnational in order that we reach the goals that we have established. More recently, when the COVID-19 outbreak came up in early this year, the Commission had a particular step towards data and COVID data, as Pedro just presented. Very early, still in March, I think, the European Commission presented a plan, an Era versus Corona Action Plan, European Research Area versus Corona Action Plan. And this plan included 10 measures that Europe would put in place in order to face the pandemic. Several measures, some of them included the opening of calls for new research, new innovation actions in order to reply to the pandemic. But one of these actions was the creation of this portal that Pedro just presented, the COVID-19 data portal. So this is molecular, I thought we also had some patient data here. Maybe we can discuss that later. After what Pedro's presentation now, I was not sure actually what kind of data it's being gathered exactly now. And the European Commission also opened calls for projects directed to COVID in all areas, not only health data, which is mostly the focus of our discussion here, but here you can have some examples of how, in this case, projects that were already ongoing redirected their activities to tackle COVID-19. So the European Union, until September 2020, invested almost 500 million from Horizon 2020, the Research and Innovation Program, to fund projects that were ongoing and redirected their activities. And also, of course, new projects were funded. You have here some examples of the project Eden, Conception. They are all online, Vaccines for EU. They are helping the European medicines agents to gather real-world data on COVID treatment and vaccines, and also Radar CNS that uses wearable technology and mobile devices to assess the impact of COVID-19 lockdowns. Again, I don't know the details of all these projects, but these are all available and currently contributing to the European response to the pandemic. And also new projects started during 2020, specifically targeting this response. I have here like a small selection of projects that are more related to health data and how this can help solving or giving the European and global response to the current pandemic. Anyway, COVID will go away we don't know when, but it will go away. I think we can learn a lot from what is happening, looking at the positive side. But from my side, what I want to tell you too, it's that the European Union will continue funding and there will be many funding opportunities in relation to health data, not specifically COVID, but in general. Although this is an European program, and mandatorily we need to have projects including 3 member states or countries associated to the program. This is a program that is open to the world. So the participation of other countries, of third countries, it's very welcome. So I would like to give you here, this slide is confidential, or this is all subject to change. These are possible topics that will open, possible calls that can open within the next couple of years, that will provide opportunities for the research and innovation community to apply to solve these challenges that the Commission is posing. So you can see data-driven decision support tools for better health and care delivery and policy making, new methods for real-world data, innovative tools for the use and reuse of health data, scaling up multi-party computation, so on and so forth. I can give further information on this for people who want. So my take-home message, and you have my email in the last slide, and from what I think I can give to this roundtable, it's that a lot is being invested. It's not only the money, it's the fact that we work together and we learn from the experience of each other's. And this is the thing that we have then to upscale, and to do. The difficult part is always to promote the real uptake of these solutions into the healthcare system, so that they really translate in the improvement of health to the citizens. Thank you.
Thank you so much, Patrícia. I love the last slide where you finished the presentation, because it's really the picture of harmony in humanity that we all seek after this pandemic, get back to our better self as a species. Professor Gupta, you want to finalize with your last slide that we missed in the presentation, and we start the debate from that one?
Yes.
Fantastic. So we'll drive the debate from your last slide.
Yes. So, I was talking about the availability and allocating resources through incidents. This is being used in our current even pandemic. Pedro made this very interesting presentation, and if you look at the research collaboration, when the entire world was in a lockdown, it all happened online, digitally. Even the repurposed drugs use data and AI. So I think all of us have seen increasingly how technology has come to our relief during the times of COVID. If you look at Taiwan, this is a place which is like 850,000 people work in mainland China. They have a 23 million population, but what they used was merging the arrivals data, the immigration data with health insurance data, made it available to pharmacies, to hospitals, to healthcare providers. We're not surprised they just had 7 deaths and 530 cases, being still very close to the epicenter. So it was all about data being used to manage COVID. In India, we had 140,000 downloads of Arogya Setu, which was developed specially for COVID. The best part was that it helped us identify 3,000 hotspots. So we were able to warn people. I have an app. When I did this air travel, I need to necessarily show before entering the airport, which says I'm safe to travel. So we have used data, and this data has, I think, been coming handy for us to manage this pandemic. So you can see from my starting of the Kenya, where malaria, right till, people using social media, us identifying where an epidemic or a pandemic is happening or a disease outbreak is happening, to allocating resources. It is all coming to data and collaboration. I think this is COVID has brought forth the reality that existed. We probably looked at not from an emergency perspective. That has brought, I think, world to agree to a point saying that it is a must-have. That is what my message was, and I'm happy to be a part of this panel and discuss this further. Thank you, Paul.
Thank you so much, Professor Gupta. And last but not least, Kaveh Safari. It's really a great pleasure to have Kaveh here with us. Yeah. He's the global manager for the healthcare in Accenture, a global firm. Kaveh, I have this feel. I already tell this once in a previous forum that sometimes I realize that governments are like blind people that are trying to go without their Labrador dog, and the consultant firms like yours are like the Labradors that every government should be using before making decisions. Like, for instance, we have now the apps that are going to be a waste of time because it was created an app that wanted to be mandatory. This is just not the case of Portugal, because there's lots of distrust, as we already saw this morning in the opening panel with Suzanne Gaunt and Charles Alesi from IMSS and other chief medical officers from different parts of the world, including your country. There's distrust in data. And definitely, do you think that a consultancy company could help government save lots of troubles? I mean, probably you're going to agree with that, but can you comment on success stories that you could have on that?
Well, first of all, thank you, Paul. It's the first time I've ever been called the dog as a compliment, so I really appreciate that.
A Labrador.
Yeah, Labrador. Oh, smart dog. I like that. Yeah. So I think I'll maybe answer the question slightly differently, because the issue is less about the kind of work we do, but what happens in a global well, I would say this: a pandemic in a digital age is something we've never seen before, and the convergence of those two is creating a very interesting challenge for any organization, because it's not possible for them to solve the problems that exist within the institutional knowledge that they have. This pandemic has forced on every dimension a level of cooperation and interaction that requires people to relate to, know, understand what's going on outside of them. And so organizations that have the benefit of sharing information and experiences tend to be able to do well in these kinds of situations, largely because we're connective tissue between a bunch of different types of organizations. I'd like to actually, though, make a comment on what the presentations were, because I think they were really excellent in terms of this idea about how, and Professor Gupta made the point about the amplification effect of COVID on digital technology. I mean, technologies all pre-existed. Obviously, pandemic is something as society we've dealt with, but nothing like this scale for the last 100 years. A combination of those two is quite interesting. What we heard here was the data being used for scientific discovery. The clock speed of scientific discovery is unprecedented. But we also, data was critical for the society's ability to meet the surge capacity needs, because the demand and the supply of services and people to meet the pandemic were not in sync at all. And so the ability to understand and match supply and demand and move resources became something that both digital technology and the data itself were critical for. What we're seeing now is in the world of mitigation and contact tracing. The ability to do contact tracing is highly dependent on sets of information and the sharing of information across parties that we really couldn't do as well, in theory, put the political issue aside for a second, without the kinds of data. And then the last one is the economic resiliency, because the consequences of this pandemic are as great economically as they have ever been, because of the fact that people could move around, and our economic production is based on mobility and global mobility. And so you stop that, and the alternative is for people to find and cooperate, share work and cooperate without physically being present. And that becomes highly dependent on data moving back and forth. So what we have seen really is the ability to respond to the pandemic is essentially completely dependent on our ability to generate and share data. And without it, it would have been a much more tragic situation, both in terms of death and economic consequences.
Definitely. Yes, so let's open up now the panel for conversation. I hope that we can flow on what we had on this, and because health data and COVID-19 is definitely probably making such an impact that the health services after COVID will never be the same, right? Maybe anyone likes to comment?
Well, I think I think that the clock speed of innovation, scientific discovery, which we heard starting with what Pedro talked about, is really unprecedented, and it sets a bar for scientific discovery and innovation that we will benefit from greatly in society. What's interesting, though, is that the real benefit isn't going to just be the discovery. It's actually going to require us to adopt these advances. I mean, truthfully, society won't benefit until the vaccines and the therapeutics are actually disseminated and used. And that's a different step. And that has its own sets of issues, some of which require cooperation, data, et cetera. So I think as a society, for us to fully benefit from the speed of innovation around the scientific discovery side will be to figure out how to drive the adoption side as well.
Definitely. And speaking on adoption, Professor Gupta, you had a success story with your app on India, right? How was that process developed?
So, you know, this is something that we realized early on, that in a large country like India, you know, imposing people to have practicing physical distancing, you know, and following the norms is going to be tough. You know, we have to be realistic that we are a lower middle income country. And we also, on the other side, have technology proliferation. If you look at the number of mobile connections, the broadband uses, the best part was, let's try out something like this. And contact tracing, I think, like Kaveh said, Kaveh has worked in India to the best of my knowledge. If I can recollect, I was in Reliance, he had joined Reliance, if I'm not wrong. But you know, what we realized that India, the usage of data is pretty high, even if you look at from a global perspective. So we decided to use that. And our Prime Minister has a very good, you know, equity among people in terms of following what he says. So he made a personal call to people, start using Arogya Setu. And I'll tell you what I have personally seen. You know, in my building, we have 52 flats. I got an alert saying there is someone who has come in who seems to be a potential carrier of COVID. We checked with the security and we figured out it was a cable man who had come. So we have seen the practical application of how technology can save you. But let me give you the other side, Paul. I think this is a very good forum that, you know, you have, you know, curated, and it would be wrong if I didn't touch that point. On one side, we have technological maturity. We have technical solution for everything that the world needs. Any challenge you give, I and Kevin and others, Pedro, will give you 10 solutions which are ready. But the challenge is the organizational maturity. The organizations are not ready. The people are not ready. I think what we need is a global debate with global forums, you know, like yours, the World Trade Organization, the World Health Organization, and UN, to instill people a trust in technology, you know, that it comes. And, you know, the other thing that we'll need to do is to disseminate the idea of data as a global good. Because I think that's a serious challenge. Today, people are questioning, despite this 140 million downloads and saved thousands of lives, still people are questioning who developed the app. The question is not of who developed the app. The question is it useful? I think we need to create trust in technology. We need to come with evidence. COVID has, I think, as Kaveh has said, fast-tracked the adoption. When last year I started writing a book on digital health, I wanted this adoption to go ahead. I worked on every particular forum in the world. When COVID came, I didn't have to do that. I had to just complete the book. That's it, because the evidence is mounting. I mean, you and I can't live without using technology. So I think we have to look at both sides. Once you have got the governments, which will push for it, then you have the providers, and then you have the users. My challenge is the users. I have no challenge with the first two. So I think that gap needs to be bridged.
Definitely. Okay, and now about science and research. Patrícia and Pedro, what are you experiencing from this situation that can leverage the contribution you could do to society?
Maybe I can start, Pedro. From the science side, I think that the most striking or the most positive side was that we faced we had a very fast reply, and we saw people that never thought of working together, coming together very fast in order to reach a specific goal. I work in health research and innovation for a few years, and unfortunately we still face, but it's general, it's not only in Portugal, some difficulties in putting academics working together with clinicians, with the data scientists and molecular biologists, and so on and so forth. So I would say that if there is a positive side for science from COVID, was the fact that it showed us that we can work together fast for a common goal. We saw that at national level, at European level, which is the ones I follow most. New teams came together, people that had never met together, sectors that were not working together, facing a common goal. So I think this is a great lesson for us in terms of health, more practically, more health systems and implementation. I think this was discussed somewhere else, but we faced advances in a couple of weeks that we would wait years for them to happen. So let's also take the best out of that. But for science research, everybody came together in a few days, I would say, a common goal, putting efforts together, industry, academia, all sectors together. And this is something that we have to preserve for the future.
Yeah, I'll more or less follow the same lines. But I think, we've been doing this now for a few months. It's quite intense, and I don't think it could be easily reproduced in another setting. And I think it could also not last at this pace for another year. People are just exhausted at this point. But it's interesting to know that I think it would not be possible to coordinate this better from a top-down perspective. I think that's a good lesson to learn. I think if, say, Europe and the US and other countries would decide to say, this is how research should be done, I don't think it could have been coordinated better, even though there's some wasted resources and some duplicated efforts. I think the scientific community has done as best that I think could have been done in the short span of time. There is, this connection to the human genetics and to the health records. It's still not possible to do at the scale that would be not ideally done, because there are many countries that simply just don't have this set up. The North in Europe.
Could India be an ideal lab for that?
To set up the health records and the genetics? I don't know about that in India. I know in Europe, even in Europe, I guess the Nordic countries and the UK have this well set up in terms of health records and human genetics. But even the rest of Europe has not done this well. Germany has lagged behind, and the US, because of the perspective coming mostly from the industry, it has its own issues, I think, as well, in terms of being able to do this properly. So I think that's one aspect that was not, I think, still done as easily as it could be, and also the translation to clinical trials, which in this case was particularly difficult. You wanted to rush as quickly as possible, maybe jumping over some typical model systems that one would use before going to human. And that's still also an aspect that still, this transition it's still not easy by any means, but it shouldn't be easy because, you know, it's quite important that it's safe. But maybe there should be still better ways of doing that.
Definitely. Thank you so much, Pedro. Kaveh and Professor
Yeah.
Gupta, any comments?
I do. Well, first of all, I agree with Pedro's point that I think that the scientific discovery is unprecedented and it required global cooperation. And you know, the urgency, the global criticality of it was what was driving. But at the end of the day, if you think about it, data is a double-edged sword because it gives us the ability to know. And the ability to know gives us the ability to create benefit, but it also is a significant issue around our notions of privacy and sovereignty. And this is what Rajendra was actually, I think, touching on. The challenge is that at an individual level, and you see this playing itself out in live time around issues like contact tracing, right? Is as a society, public health has always wanted to know who has a disease in the interest of the public. And there's always been this challenge of the individual feeling stigmatized about whether or not anyone knows that they have the disease and the public's desire to know in order to mitigate the disease. Now that we can collect that information passively, that just makes the situation worse. It doesn't make it better. It doesn't help the individual who's fearful of stigma. A live example in the city that I live, something as simple as the ability to tell first responders if they were a fire or ambulance, if police, if they're arriving at a home, that there's a COVID positive person in that house. The legislature basically created an ordinance that said that they need to know. And the executive for that geography reversed the position and said no. Why? Because they were afraid that they wouldn't get any responses if the fire or the police knew. And technology just made the ability to know that passive, which made the problem even worse. But it was a political and a social problem. And we see the same issue going on right now around agency. Healthcare is fascinating because at the one level, we as humans, our biologies are the same. It knows no national boundaries. But every country considers the health of its population to be a sovereign asset. And so while it makes complete sense for us to try to understand the body and discover treatments in a global way, or to care for each other in a global way, the notion of sovereignty, that we belong inside of a boundary and therefore that information can't travel, that didn't get solved by data. The problem just got worse with data because now we have more dimensions that we have to address, not just my physical presence, but my digital presence has to be managed. So I think we are having an interesting challenge in that these fundamental social or these fundamental political and policy issues haven't been addressed, and we've just made the problem even more complicated by adding more dimensions.
Yes, it's interesting because it's so true. Professor Gupta, any comments on this?
Yes, on the collaboration side, I'll just talk about the practical example. So there is a COVID vaccine trial going in Oxford in the UK, and India is the largest producer of the vaccines in the world. Serum Institute produces 70% of the world's vaccines. So just imagine that COVID has only connected those dots of research, trials, and the production, and then it will eventually land in the supply chain. So I think the world gets more connected thanks to COVID, though not the right thing, but politically we are more divided than ever before. So I think it is required that science and politics, which never walk together, will find a middle path. If they don't, we always aggravate a problem because as I think Kaveh said, that the district executive reversed the orders. Let's follow science, as simple as that. And science would help solve our problems. But the only question is, working with politicians, how do we make them understand political science and science are different? That's a challenge. We hope forums like this, if you get more policymakers, eventually we'll arrive at a middle path. That's what I hope, optimistically.
Definitely. So we are approaching 10 minutes before the hour, and probably there are some questions here on the participants in the audience. If there's participants in the audience that I would like to place a question, it's your moment. We are a global summit, so we would like to have participants also to voice their questions and their any comments that they would like to add to the debate. If not, then I will try to make it the last round and close the session. So no participants on live now. It's your last chance. 1, 2, 3. Okay, so last round of final comments. So we have here an interesting set of presentations that were offered in the start of this presentation. We also had an interesting discussion within both the perspective of the technology, policy making, and science and research. In the end, the conclusion is that definitely politicians and science need to be together. And that's the conundrum we need to solve, because obviously we all understand that politicians require protagonism, that then science will tell in everything they need to do, then the politician would not be at all pleased with that situation. But anyway, a final round of conclusion of observations, and I will start for the order of the presentations. Pedro, Professor Gupta, Rajan, maybe Kaveh, you could close as you didn't have the presentation, and you are the consultant, so you probably give us some advice in the last round of comments to us all. Okay, so Pedro, Patrícia, Pedro, Professor Gupta, Patrícia, and then final round for Kaveh. Last observations, and we'll close the session. Pedro.
Yeah, so I guess 2 points. One, as somebody who works with data very often, and I still see, in many different countries around Europe, but also around the world, there's still the capacities both in the health sector and still research, and definitely the political side, of being able to understand how data needs to be used and sort of implementing in practice things still lags behind it. It still goes to fundamental education still. So in the education system in many countries, people are still not being put through in the educational systems with the knowledge to be able to do these things. And I think that's something that it still needs to be addressed. Or a more optimistic and positive take out of this, I think, I would definitely say that both the science community and the medical community should be put on a pedestal. I think they've done amazingly well throughout this COVID crisis. It's still not the time yet to look back, but I think we're going to look back and be very proud of how the health sector and scientific sectors have responded so well.
Fantastic. Thank you, Pedro. Thank you so much, Professor Gupta.
Yeah, Paul. The part that we all have faced through COVID in the last 7-8 months is that we have seen close family, friends, and colleagues being affected by COVID. Some having lost lives. There's a whole lot of seriousness around it. This is the time to put the momentum into action rather than losing it. I think as humanity, we have this trait of forgetting and pushing it behind us after a while. So I think what we need to do is move fast and define the global governance, ethics, and regulations with regard to data. That's the key. I'm going to talk about it tomorrow in my session.
Thank you.
And the second thing which is important is capacity building. We do not have the likes of Pedro's in every country, and imagine we are 7.8 billion. We do not have people like Patrícia or Kaveh. We need to have capacity building given what we face today. You cannot be managing millions of people, with few concentrated places. I think we need to have that leadership qualities, understanding the entire ecosystem. So whereas it appears complicated, but if we disseminate the message pretty well with action points, I think we should be able to be better prepared should something like this strike again. And there is no guarantee it will not strike. Thank you.
Thank you. Thank you so much. Patrícia?
And a follow-up of what my speaker colleagues have been saying, I think that this is an opportunity and we have to take the best out of it. I think that transformation of health and care systems globally, it's a very complex endeavor and that it needs to be addressed from many angles simultaneously. But this is a good opportunity for us to take this endeavor, and the success will depend on the ability of the decision makers to learn from each other, to look across national and regional borders and also across different sectors and learn from this and take advantage, take stock of everything that has been done so far, so that we can really use this period and ensure the transition towards a more sustainable, resilient, innovative, and high quality and people-centered health and care systems globally.
Thank you so much, Patrícia. Thank you so much. Kaveh, last but not least, closing comments.
So I think this pandemic has proven to us how critical and dependent our society is on digital technology and data, and that we simply can't survive both from a physical and an economic perspective anymore without a base. However, even before COVID, we began to recognize that digital technologies and all of the issues that sit around the data conversations are fundamentally being limited by the ability to address some of these policy issues that we described. In fact, our global survey on digital health adoption showed that the adoption rate of digital health technologies has actually flattened out over the last 2 years because of personal privacy, individuals' concern about who has their data, because the experiences, the digital experiences didn't work, because the delivery system didn't recommend it, even though the consumers were using it, all kinds of reasons. All this says is that if we don't address not just the issue of are things possible, but are they permissible, we're not really going to benefit the full, gain as a society the full benefit of the technologies that we have evolved. And I think it's incumbent on both sides of the equation. So for those on the technology side who are building, to recognize that simply building it isn't enough. And then for those that are on the delivery system or the consuming side, to recognize that there are a set of answers that are simply not possible without availing themselves of these capabilities that exist. Both sides are going to have to work to bridge that gap. It's not going to be one side or the other.
Guest speakers for your presence here. I just would like to remind you that in the afternoon we are going to have interesting keynotes from WHO David Novillo-Ortiz, which is responsible of health data, and is going to talk at 2 o'clock here, along with Lars Montelius from the INL, our research and development global partners in the Health Data Forum. We are very proud to have INL, International Nanotechnology Laboratory, as a partner. And definitely, Patrícia, this is not a pitch, but from what I see from the AICIB, there's definitely a lot of synergies with the Health Data Forum and AICIB that we could construct together, because there's going to be a lot of work to do on data and healthcare. So thank you so much for joining here today for this session. Let's go and have a lunch break on this side of the world. And Kaveh, a start of the day for you. And Professor Gupta, a good evening for you, right?
Thank you. Thank you.
Thank you so much.
Thank you all.
Thank you.
Thank you. Goodbye.
Bye.